Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is SOFEA BINTI, mention number 1211128, and today under course THH 1003 Anatomy and Physiology for Technologist, I'm going to present on cardiovascular system. So regarding this system, the main anatomy is a blood, the heart, and also the blood vessel. And I'm going to talk about the basic function for each main anatomy. Okay, so first of all, I would like to talk about the blood. The function is it transports oxygen and other essential substances throughout the body, fight the sickness, and perform other vital functions. So basically, our blood contains of two components, which is the blood plasma, 55% in our body, and the rest, 45%, is a foam element. The foam element consists of the platelets, red blood cells, and also the white blood cells. So as you know, for red blood cells, it will bind with the oxygen and it will go to our cells body to provide oxygen to them. While for the white blood cells, we have 5 types of white blood cell, which is the neutrophils, lymphocytes, monocytes, eosinophils, and also basophils. So basically, white blood cell will find infection and attack. It also will create antibodies to help your immune system fight off the infection if it happens again. And the other component is platelets. It will closing up the wound by creating a thick barrier that blocks the loss of blood. Okay, so next we go to the heart. The heart is roughly the size of a fist and sits in the middle of our chest, slightly to the left. Its function is to pumping the blood around your body as your heart beats. Basically, the heart has 4 chambers and it has 3 layers of tissue, which is epicardium, myocardium, and also endocardium. The 4 chambers it is right atrium, right ventricle, left atrium, and left ventricle. Okay, so we're going to focus on the right side first. First of all, the right atrium will receive the oxygen poor blood from the superior vena cava and also inferior vena cava. So when the blood arrive at the right atrium, it will pump the blood through the tricuspid wave to go to the right ventricle. So at the right ventricle, it will pump the blood through the pulmonary wave and straight to the pulmonary artery to go to the lungs to pick up the oxygen, as the blood is oxygen poor blood. So it goes to the lung first to pick the oxygen and return to the heart through the pulmonary vein and straight to the left atrium. Then it will go through the mitral wave, or we call it as bicuspid wave, and go to the left ventricle. Okay, so as we know, the left ventricle is the strongest chamber and than any other chambers, as it has a thick muscle to pumps the blood to go to the rest of the body. So the blood will go through the aortic valve and straight to the aorta, and the blood which is oxygen rich blood will travel to the rest of our body to send the oxygen. Okay, now we're going to talk about the blood vessel. The function is to carry blood to and from all parts of the body. These vessels carry blood in both the direction, which is one from the heart to all other parts and another from all the body parts to the heart. So basically, we have 3 types of vessel in our body, which is artery, vein, and also capillary. But these 3 has some difference. The function of artery is to carry oxygenated blood away from the heart, except for the pulmonary artery. The lumen is small and narrow, while the wall is thick. The other features is the presence of muscular walls, which is the largest artery, which is the aorta. And for the vein, the function is carries the oxygenated blood from the body parts to the cells, except for the pulmonary vein. The lumen is large, while the wall is thin. It also has the presence of valve to avoid the blood flow of blood. And the last vessel is capillary. The function it takes care of the diffusion of gases and nutrients from blood to cell of the body. Its lumen is very small and the wall is very thin. The other features is it is semi-permeable walls for the transportation of gases and nutrients. Okay, so regarding about the technology associated with the cardiovascular system, I would like to talk about the pacemaker. Okay, so pacemaker is a small device that is implanted into a patient's chest or abdomen. It uses low energy electrical pulse to mimic the heart's own electrical signaling to beat at a normal rate and rhythm. So the pacemaker can also coordinate the electrical signaling of the heart between the upper and lower chambers of the heart. They can coordinate electrical signaling between the ventricles to prevent the heart failure. Pacemaker can also prevent the dangerous arrhythmia from occurring in patients who suffer from long QT syndrome, which is characterized by chaotic and rapid heartbeats. It also ensures that the right and left ventricle contract normally if patient suffers from atrial fibrillation and irregular heart rate that affects proper blood flow. So the pacemaker can speed up a slow heart rhythm, and a patient who suffers from irregular heartbeat or arrhythmia may need a pacemaker to keep his heart rate steady and regular. So the newest technology also has the pacemaker to monitor and record the heart's electrical activity and heart rhythm so that the doctors can obtain all of this information from a patient over time. So that's all for my presentation. Thank you. Assalamualaikum warahmatullahi wabarakatuh.